Jazz hands. Hey. Good afternoon and welcome to the Health and Human Services Committee. It is Wednesday, March 20th and the time is 1:08. Thank you all for bearing with us. We had some technical issues this morning with our Zoom. I want to call the meeting to order. Are there any changes to our agenda? Nope. Okay, our chambers are pretty empty and we do not have anyone here for public comment, so we'll move through that. As far as the chair's report, I just want to address, I know that we had some individuals come last night for public comment. We've also received some inquiries into some of the environmental health concerns that are happening in areas known as the jungle and the encampments in on the west end of the city of Ithaca. And I want to make sure that to first of all thank people that are writing in and letting us know. There is a website that's set up to accept pictures as well as complaints for people that would like to place those grievances. The email address is eh@tompkins-co.org. We also have, if you look up on Google, you could look up Environmental Health Tompkins, and it will take you to a form on their website where you can fill out information and submit photos. Lisa Holmes is here. And Lisa, do you have a county administrator's report?
I do not have any updates today.
Thank you. And we do have a few resolutions. And we also have a presentation from the Human Services Coalition. And John Mazzello is here from the Human Services Coalition. Why don't we go ahead and we can go through our resolutions and then do the presentation, if that's all right? Is that all right, John? Okay. So first off, we have Department of Social Services. And let's see, Kit Caphart is here from DSS. Hello, Kit, how you doing?
Hi, Shauna, good, how are you?
Good. We have one resolution, a budget adjustment, Department of Social Services, increase of spending authority for mandated child care daycare program, ID 12252. Can I have a mover, please? Moved by Randy, seconded by Amanda Champion. And would you like to speak to this, Kit?
Sure. So this is, as it indicates, this is 100%, there's no impact to local costs. Sorry, I said that wrong. So there's, this is really something that we have seen an increase in social services being able to help people with daycare expenses. That eligibility program, as people probably know, has expanded over the last 2 years. We've gotten 4 or 5 updates on regulations. We're seeing really increased income eligibility levels, which is great. And really, we along with our district, as well as across the state, steps have been taken to reduce or eliminate the family share down to the kind of the bare minimum. So that really helps families be able to access services. And the state has really increased allowable absences in daycare. So all of this amounts to more people eligible and greater benefits being allowable for people. The challenge, of course, with childcare has been that there haven't been as many providers as anybody would hope, but we are really encouraged with this increase that we saw. We are seeing that people are finding providers and they are able to access care for children. So what we're asking is for that 6034223 to be increased, and it's really just the spending authority. This is not going to impact our local cost at all. So this is a good thing, and we are hoping, we're expecting to find out after the budget passes this year that there will be rollover available that will cover any increases for next year as well. So all of this is probably really good news and good care for families and children.
That's great, thank you, Kit. Are there any questions from committee members on the resolution? Randy?
I would comment and a question. At the Monday Youth Services meeting, and maybe Kate will talk about this, we had a good presentation from the daycare center on Kyneton Road, and they went through a lot of detail. It was, I think, a good half-hour discussion, and it's so expensive. Daycares is so expensive, but they're making progress there, and they have a waiting list there, I think, of 200 kids. So, and I think they can handle about 80. But my question is more of an operational thing. So when we pay the providers, do we pay them, the state reimburse us, or how does that work?
Yes, we are typically paying them, and then the state reimburses for those expenses.
How long does that process take? Is it 90 days? Is it 30 days?
No, it's longer. I would have to check with our fiscal people because I don't know for that program specifically. It can be up to a year before we see those reimbursements back. This is remember that childcare, there is a block grant, so we're constantly operating within that block grant year. For reimbursements. And there's a combination of factors there. I don't know, I would have to go back and look at when those reimbursements are due. Usually we try to lump those together so that the administrative process of processing all of that occurs at one time. But I would need to talk with our fiscal people and get more details about that. But there is a bit of a lag.
All right, I appreciate that. Thank you.
Any other questions? Okay, let's do a roll call vote for the budget adjustment ID 12252. Susan Currie? I think that's a yes.
She said yes.
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 Okay, thank you.
Sorry. My Zoom got a little stuck.
No worries. Randy Brown?
Yes.
Amanda Champion?
Yes.
And I'm a yes. Thank you. Kit, would you like to give us an update for DSS?
Of course, yes, and thank you for your approval on that. So just kind of a quick update. We currently have 211 people sheltered in our shelter. 55 people are under the THA program with 53 adults and 2 children, and we've got 156 Code Blue folks. That's 132 adults with 24 children. We're coming to, as everybody knows, we're coming to the wrap up of the Code Blue season here shortly. In just a couple of weeks, we're working with the shelter on trying to really promote people coming in to apply to continue their benefits. Other than that, we've got many things going on, but I'm not sure I have anything else to report.
Great. I just want to say thank you as well for updating us on the sheltering conversation. I know that it's the topic has gone from HHS to HED and back and forth over the years, but I think it very much so deals with Health and Human Services and the services we provide as a county. So I do appreciate you duplicating the reporting. Are there any questions for Kit? Okay, I see no. Thank you, Kit. We appreciate it.
Thank you.
Okay, Department of Whole Health, we have a resolution. Let me just make sure that there's Frank. Hi, Frank. How you doing?
Hi.
We have a resolution, a budget adjustment, Tompkins County Office for the Aging American Rescue Plan. Budget increase ID 12288. I was stuttering there because I was wondering why it was in Whole Health and not Office for the Aging for Lisa Monroe, but I'm sure you'll have an answer.
Shauna. It is Lisa. I think
It should be
put on the agenda.
under-
I'm not trying to take over COPA.
Oh, okay, okay,
I promise Lisa.
okay. So you know what, why don't we move this to, we'll move this down to Office for Aging. So Frank, why don't we go ahead and do your resolution? Authorization to accept funds, execute contract and budget adjustment, opioid settlement funds, Whole Health, ID 12297. Can I have a mover, please? Moved by Randy Brown, seconded by Amanda Champion. Can you tell us a little bit about the resolution?
Sure. We're excited to be at this phase. These are the opioid settlement funds that came through the local government unit, which is the Mental Health Division and our Community Services Board. And we had a successful RFP process and the group reviewing applications has selected Catholic Charities of Tompkins and Tioga to implement the program. So we're asking for approval of that selection and the budget amendment so we can get a contract in place and get the program up and running.
That's great. Any questions? Amanda Champion?
Thank you. So money is separate than the other settlement funds we got, right?
Correct.
Okay. And I guess I'm just wondering, will we hear more about what Catholic Charities is doing? Will we get a report from them? I don't know, just wondering, like, in the future, how we'll follow up with this.
Sure. So the reporting requirements will go through the Community Services Board as they have oversight of these funds, but I can certainly make that reporting available to all of you as the program gets operational.
Great, thank you.
Yeah, they gave a good presentation at one of those meetings and showed how they thought it was going to work out. And it was very, very good.
Okay, great.
So Frank, I also just want to confirm, I know that Catholic Charities has a religion in the title of their organization. Just want to make sure that this is going to accommodate people of all creeds, religions, sexual orientation, genders, all that.
Yeah, absolutely. The funding would come with non-discrimination clauses associated with it.
Okay. Any other questions or comments? Okay, let's do a roll call vote. Susan Currie?
Yes.
Amanda Champion?
Yes.
Randy Brown?
Yes.
And I am a yes too. Frank, do you have any updates for us?
Yeah, a handful actually. First, I know there's been a lot of interest in more opioid overdose data, and yesterday we were able to add to our opioid data webpage more information about the deaths that have occurred in our county over the last 5 years. We went back into our medical examiner data and were able to pull out some demographic information about the 100 deaths that occurred in that 5-year time frame. This data is for unintentional overdoses only, so it doesn't include suicides or perhaps a vehicle accident that was caused by drug usage. It is really those that were unintentional in that somebody was using a drug and an overdose and died without any other cause associated. So that demographic data is now out there and available. It is only 100 people only. It's 100 people too many, but it's still a relatively small number, so it doesn't, I don't know if there's a lot of conclusions that can be drawn out of it. I think the one thing that jumped out for me was in the occupation data. There were a large number of food service, people in the food service industry that fell into the data. And so there's definitely an opportunity there for us to dig a little deeper into that and see what we might be able to do. But this is the first step in kind of trying to advance the data that we have about overdoses. We control the medical examiner data because the medical examiner program is part of whole health. The overdose data that doesn't result in death, we don't own that. So we are now moving to phase 2, which will be communication with our community partners that might have more access to that data to see what we might be able to get from them to add to the data pool. I do imagine those numbers, if we are able to get them, I know they will be larger, and it will likely be a more representative picture of what's happening within the folks that are overdosing. So more to come on that front, and that'll be kind of the next phase that we're focusing on. But wanted to alert you all that data was up there now.
Thank you.
One other thing, the Alcohol and Drug Council, I haven't had a chance to talk to this group since their announcement that they were suspending services. That's obviously an unfortunate event and not something any of us wanted to see happen. They have been spending the last 3 weeks, we're focused on discharging patients to make sure that there was a safe transition of care. That process will be coming to a conclusion at the end of this week. I believe at this point, everyone has been contacted that could be contacted and has been offered the opportunity to transition care. So that part of the process is coming to an end, which means we will then be able to shift our focus to the future. I've been having regular calls with ADC and Oasis about how we might move forward with this. We likely will be RFPing for all of the funding that was associated with the Alcohol and Drug Council. So we've already internally begun the process of starting to put some of those RFPs together. There's 3 components of care. There are prevention services, there are outpatient services, and then of course the detox. The prevention piece we're moving quickly on. It's about $180,000, and it's you don't have to be a licensed provider to provide those services. So we want to get that out as quickly as we can. Hopefully have as large a pool of respondents as possible so we can get that work back underway. We are looking at the outpatient services to determine if we will RFP them. We have 2 other licensed outpatient providers in the community in CARS and REACH. And so we're trying to evaluate the data on whether or not having a third outpatient provider is necessary. We certainly want to encourage choice for individuals seeking care, but we also want to make sure that the entities that are providing these services can be sustainable. So more to come on that front. If it turns out that outpatient isn't the direction we go, we'll be working with the Community Services Board to determine what we might use those dollars for in the community. And then the detox piece of it, there's a lot of unknowns with that, the building being a big piece of it. So Oasis is looking into all of the legal issues associated with that. And once some of that is straightened out, then we'll be in a better position to know what an RFP might look like so we can get that put out. So those are the kind of the 3 pieces of that are underway at this point. Yeah. Does anyone have any questions about that?
No, I do. Oh, Randy.
Thank you for the update. So do the funds that you're talking about come through the county and then downstream to who, whether it was the Alcohol and Drug Council or another entity? Is that how that works? And then you manage, the county manages those contracts. Is that how that works?
Correct for most of it. There were some funds that they were receiving for the detox that were going directly to them, but we're working with Oasis to determine if that will continue to be the case moving forward. But generally speaking, these dollars do come through the local government unit and the Community Services Board, and then are contracted out to entities in the community.
And I think you mentioned this in an email, but how many total clients were active?
There was 246, I believe, in the outpatient program, and that's across the spectrum. So if somebody had just made a phone call of interest, you know, they were in that number because we wanted to make sure that everyone that was connected with the council was contacted. And there were 8 patients in the stabilization part of the facility on Trip Hanger. So all 8 of those were able to be transitioned to other facilities if they so chose to.
Thank you.
Great. And Frank, can you give us an update on the on the environmental health concerns that we've been sending over?
Say just one more thing on opioids before we move over
Yeah.
there. There have been some question from legislators about the status of opioid task force around the state. My state association on the public health side did a query last year of all the counties and kind of if they had them and if they had them. Only 8 counties responded that they had opioid task force at that time. Broome did not respond, and I know they have one, so there's at least 9. I think many of them received a grant several years ago, pre-COVID, to start those opioid task force. And I think for some counties, they were able to find a way to sustainably continue. But I think many of the counties, those task force either disbanded or are not functioning at the same level because the grant funding was no longer available. But I wanted to let folks know that information, that we did find that information. And then I also wanted to offer that the Substance Use Subcommittee of the Community Services Board is very interested in understanding any direction from the legislature that they might want them to be looking at or considering to perhaps fill that type of role. So they are open and welcome to thoughts about how, what they could be working on that would be useful to the legislature beyond what they're already doing. So that offer stands. So I just wanted to provide that info because it had been asked a couple of times.
Frank, I think my concern in regards to, for one, the idea of an opioid task force or an overdose task force, I mean, ideally you would have someone who, you would have peers on as part of that group, you would have parents, siblings, loved ones that have lost people to overdose, you would have legislators, physicians, people in the community. The whole idea would be to gather a group of people to talk about the overdoses and then actually to take action here in our county. I appreciate the work that the subcommittee is doing right now, but it's almost like they're having these conversations in a bubble, and there's a disconnect between legislative action amongst the legislators and us putting funds and adding money to doing programs that are going to help people in our community. And so it seems like, while I understand they want to do something, there's, I personally feel like there's a disconnect because their suggestions aren't getting back to the legislature, and the legislature isn't really tapping into these professionals and people with lived experience to hear what's actually going to work. And so while the 14 of us can sit around this table all day long and talk about great ways that we're going to save lives, we're not the ones in the trenches, and so, my fear is that we're not having those conversations, quite honestly, and I think that we need to have those conversations.
Yeah, I agree, and I think we can do some work to improve that communication about what's going on. Many of those groups that you just referenced are part of the Substance Use Subcommittee. We do have peers, we do have family members, we do have providers in the community. So we will work to try to bridge that gap so that way we can make those connections. Because honestly, there's a lot of things going on related to this, and perhaps we are missing the target in communicating that effectively to you all in the legislature. So we will definitely work on trying to improve that.
Lisa Holmes?
Is there currently a legislative liaison to the Substance Use Subcommittee?
There is not. Randy is the liaison to the Community Services Board, but each of the subcommittees does not have a liaison.
Okay. And I think whenever I was on the Community Services Board, typically for the subcommittees, there would be like a 5-minute report out. And whenever I was on there, most of the time there was not a report out, and so you weren't actually hearing from the providers. It might have had 2 or 3 people on it. It was not a very active subcommittee.
Yes, I would agree, and I'm happy to report that things have improved. I would say dramatically. We have a lot of new faces on the Community Services Board. We do have new leadership on the Substance Use Subcommittee, and they are a very active and engaged group. And Harmony Ayers-Friedlander, our deputy, has done a really good job of engaging those subcommittees. So I think today, Shauna, you would see you would have a different experience than we've had in the past, which is a good thing. There's still room for improvement, and we're still growing, but I think there's opportunity here, and so we'll go back and do some brainstorming and talk with the leadership on the subcommittee and the board about how we improve communication with the legislature.
Great. Randy?
Yeah, I've only, this is my second year on that board, and I have seen improvement and a new leadership, and a good group of new board members came on. They're professionals and one with lived experience. So I think it is improved, and I think they're trying to figure out now their mission.
Okay.
So that's where they're at.
Great. Okay. Thank you, Frank.
Did you want me to?
Yeah, why don't we, I'm not sure we're dying to talk about this, but we probably should.
I know, I've been a little busy. So on the EH front, our staff has been busy collecting information. We're getting the pictures and the reports from the community similar to you are. Thank you all for forwarding them to us when you're getting them. They've been out on site to physically see for themselves and starting to document what's going on out there and kind of the extent of it. This week, our environmental health director and her staff are meeting with the railroad and the city to begin conversations about next steps and what needs to occur. So we are still actively, working that front. I will say, as I did when we first talked about this process is slow and deliberate when we get into enforcement. And so, I want folks to know we are working on it. It does just take some time to kind of navigate through the processes that we have to move these types of things forward. But I'm hopeful that we're at the table this week and we'll begin to start putting some plans together on next steps.
Any questions? Randy Brown?
Yeah, thank you, Frank. So there's a lot of, I went down there, and there is a lot of contaminated material in the water, which I think isn't water, isn't that the New York State, that's DEC issue? So I think it'd be a good idea to inform them of what you've spotted, or we've spotted, and somebody from there should be going down there and looking at it and maybe cleaning it up. And also that would add a level of enforcement. So I think that's my opinion on that.
I agree.
So Frank, is the conversation, because I feel like we have been going round and round with the city for years about whose responsibility it is, how to keep it clean. I mean, the county even gave, I believe it was like $50,000 to help them clean up all the junk. And the reality is, unless they figure out a system to where people aren't camping, people aren't dumping there, it's going to just keep happening. Is that conversation one that's being had right now?
Yeah, it should be part of the conversation, because when we deal with these types of complaints, it's not just about cleaning up the mess, it's about ensuring that it won't happen again.
Okay.
Obviously, this is a very difficult issue. We all know that, or we would have solved it already. So I don't want to promise that we're going to miraculously have the answer, or we're going to be able to, force the city to do, exactly what everyone wants to happen, because honestly, I think different people have different ideas about what should happen. But I am optimistic that the new city manager is interested in this, and my understanding is that their policy that they voted on last year has directed her to implement it, and she has already reached out to us about different programming and other things that are going on in the community that might impact their approach to implementing their policy as it was voted on. So I think things are in motion. I'm more optimistic than I think I ever have been that we might actually move towards something. And that, coupled with the county's conversations about sheltering, I think all of those pieces coming together will hopefully result in something that we can all get behind.
Thank you. Randy?
Does the county have the legal right to make some declaration of the environmental issue there and force them to clean it up, or we clean it up and bill them?
Yeah, so that is a remedy that is afforded in public health law and the sanitary code. If a situation exists and the landowner is unwilling or unable to address it, the county can take action and then seek reimbursement from the landowner. My understanding is that's only ever happened once in the history of the county. And Jonathan Wood, who was the county attorney at the time, said it did not go well and was not something that really should be looked at as a very last resort. But to answer your question, yes, it is an option.
Yeah, I agree that you shouldn't be doing that often, but this has been an issue for decades. And it's just gotten worse. So you can be the messenger. That's my opinion of what you should be doing. So you don't, yeah.
So Frank, would that come from the Board of Health or would that come from you?
That is a good question. Shauna, I don't know. Are you referring to direction to spend resources to clean it up? Is that what you're asking?
Yeah, I mean, I guess I'm just wondering, like, which path, would that be a decision? Will all of the enforcement be decision of Board of Health, or are there certain things within your power that you would install?
Yeah, there are certain things that I am able to do if there's an imminent public health threat. And I know there are people that would suggest that what we have is an imminent public health threat, but it has very particular meanings in law. And so I do have some authorities, but generally I would want to go to the Board of Health for something that specific, especially if we were talking about expending county funds. And the Board of Health doesn't control our budget.
Yeah.
So they could order that it be done, but ultimately the county would also have to have some say on whether or not they were going to authorize the resources to do it. So it's, yeah, like I said, this isn't it's not a simple, and this is a kind of a very complex tool to be using for this. But yes, I have some authority. Yes, the Board of Health would be the final authority, but the legislature would have to authorize funds if we were to expend them.
I mean, I'm just thinking in regards to budget. I mean, we're already starting on our budget for next year, and we know that the small piece of land that had tons of trash and took many dump trucks cost, I think it was it $25,000 of county funds?
Something like that last year.
And it was $25,000 of city funds, so $50,000 to clean up.
I don't think it was that much. I think it was more like 15.
I was thinking.
Or is it two different times, maybe? That's
I can
why.
go back. I can go back and
Yeah, that's right. It
look.
was two different times. So-
But, I mean, either way, it was like an area that was maybe half of the size of this room that was littered, and it cost, let's just say $20,000.
It wasn't the whole area. It was a small.
Yeah, no, that's what I'm
portion,
saying.
yeah.
And so it's like, while we're coming up with our budgets, while the city's coming up with their budgets, I think it needs to be no surprise that this needs to be worked into their budget, the cleanup of that. It's a very, very large area that is completely filled with garbage. And so, I hope that's on the radar for the city, because there should be some responsibility there and financial commitment, because it's not going to be cheap.
I think it was over 20 tons. It was a lot.
Yeah, it was a lot.
It was a lot. It was a significant amount.
So Lisa, I guess the question for you is, would you mind having that conversation with Deb Mollenhoff so that they can start thinking of their budget and allocating those funds necessary in order to provide cleanup?
Yep.
Thank you. Okay.
Thank you, Frank.
Any other questions or comments? Thank you, Frank.
Thank you.
Thank you all.
Okay, next, Office for the Aging, Lisa Monroe. There have been times where I've called Lisa Monroe and thought it was Lisa Holmes, and vice versa.
Oh, that's happened to me once or twice.
Yeah.
Me too.
Hello, Lisa. We see you have two resolutions here. Why don't we start with the budget adjustment, Tompkins County Office for the Aging, American Rescue Plan, ARPA budget increase, ID 12288. Can I have a mover, please? Moved by Amanda Champion, seconded by Randy Brown. And would you like to explain this resolution?
Sure, the budget increase. I've got my resolutions all mixed up. Can you tell me the number of that one again, Shauna? I'm sorry.
Sure, it's 12288.
88, okay. Yeah, the increase. So that, yes, this is just increasing funds that, from our ARPA account, to be able to expend it basically before the end of the period, which is September 30th. And we, we'll be using this to offset some salary and fringe, and also contracting with partners on different initiatives that they're using, like Lifelong, INHS, Law New York, and Women's Opportunity Center and FoodNet. So this hopefully we'll be able to use all the funds up before September 30th.
Great. Are there any questions for Lisa? Okay, let's do a roll call vote. Susan Currie?
Yes.
Amanda Champion?
Yes.
Randy Brown?
Yes.
And I am a yes. Thank you, Lisa. We have one more resolution, budget adjustment, County Office for the Aging, reappropriating revenues and expenses to 2024, ID 12239. Can I have a mover, please? Moved by Randy Brown, seconded by Amanda Champion. And would you explain this one to us?
Sure. So this was funding that was approved for FoodNet to use in 2023 due to various reasons. One of the things that they were going to spend it on was a delivery vehicle, and the ordering process of that supply chain kind of issue still hung on a little bit, and they were unable to use the funding. So we've just moved it into 2024, so they'll have more time to expend it.
Great. Any questions for Lisa or comments? Okay, let's do a roll call vote. Randy Brown?
Yes.
Amanda Champion?
Yes.
Susan Currie?
Yes.
And I am a yes. That's unanimous. Lisa, do you have any updates for us?
No, I don't. I will say, which I'll say again next month, that our annual luncheon is coming up May 3rd. I think everybody has gotten an invitation to that, so you're welcome to come to that, and we're looking forward to it because we're going to be back in person since pre-COVID, so that'll be great.
That's great. Thank you very much. We appreciate it. Okay. Let's see here. We have two other departments that are here. J.R. Claiborne is here from Veteran Services. Hello, J.R.
Hello, everybody.
Hello.
Hi. Would you like to give us an update?
Sure. It's been a busy month. I think you heard some of my report last night at the legislature meeting, but main thing is we've had two events for celebrating our women veterans during Women Veterans Month. We had a watch party, so to speak, for a VA's Women Virtual Symposium. And then this week, Monday, we had the reception honoring our women veterans. Both events were up at the airport, so I want to give a huge thanks to Tyrone Fish and the staff there at the airport, as well as the staff at Legacy, because they did a lot of heavy lifting for us.
It's great.
And then we also have a event coming up next week, the 29th, for Vietnam Veterans Recognition Day. Other than that, I'm also trying to juggle a few financial deadlines I have to meet for this month. So that's pretty much taking a lot of my time.
Okay. Any questions or comments for JR? Okay. Thank you for coming to our meeting last night, JR. It was good to see you.
Thank you. It was my pleasure, and it's good to have those proclamations that I can share with our veterans.
Great. Thank you.
Thank you.
Next, we have Kate Shanks Booth from Youth Services.
Yes, good afternoon. It looks like the snow slowed down just a little bit outside. It was a whiteout a minute ago. So I have four things just kind of listening to the meeting that I wanted to touch on. So Randy had mentioned the presentation that we had at our youth service board about the child care. We have implemented sort of a new strategy of bringing content experts in every month to our board to sort of update them on different areas of youth development and what's happening in the county so that they can be better educated when we talk about funding recommendations. So this month we were joined by Heather Mount from the Coddington Road Community Center, and she was talking about their expansion, things about the lack of space, the rate of childcare pay, those type of things. So, and we know that we know what childcare desert and those things. But she did say that their center had a 200 youth wait list, which was, we know it's bad, but when you hear numbers like that, it's kind of staggering. So we continue to work and hopefully help remedy that as we can. The other thing that I wanted to just highlight was yesterday the Tompkins County Community Service Board Mental Health Subcommittee hosted that was a mouthful, hosted an hour and a half long conversation with folks from the different school districts in the county talking about the mental health needs of their youth. And obviously, needing more mental health people in the schools was really, really important. The people that are there are overwhelmed.
Kate, we can't really hear you. It sounds like a vacuum is running, maybe?
I've been getting that so much. Is that better?
Yeah, that's better.
Okay, try this. Harmony, Aaron Friedlander was there at the meeting, and she was listening to different recommendations.
Sorry, we can't hear again.
Give me 2 seconds. Maybe Dr. Clark could go and I'll come right back.
I'm sorry, we can't hear her.
She says she's going to come back.
Oh, she's
Very
come back.
muffled.
Okay. Okay, why don't we hop to Reverend Ken Clark from the Office of Human Rights? Reverend Ken, are you with us?
Good afternoon.
Hello.
Just a couple of things that I have to share with you. As I mentioned some time ago, we had received a grant of $25,000 to work on dispossession, migration, and racism from the Cornell Just Futures grant, and we are working on creating a documentary related to immigration issues. I'm working with Tom Hubble Photography, a local business here, and we are in the process of beginning to, Tom will be traveling to begin to interview refugees and actually visit the border and to this will enable us to fulfill one of the objectives for the grant, which was to produce a documentary around issues of migration. And we are now currently planning a program to be held within the next month or so on migration, which will be part and parcel of that work. Also, too, we are working with Dominic basically to create a new look for OHR, to create a new brand. We did a survey in which we got input from probably about 70 people, including OHR stakeholders. And we have created some samples of what that new look or new branding would look like. I think we are close to coming to a conclusion about what we will choose and then reveal to the public eventually. And we'd like to do that through some sort of open house sometime later this year. So we are working on that. And today, I had the opportunity to give a presentation at the high school during their social justice week. It's the second year in a row in which I have been invited to present. And I spoke about civil rights and citizenship and a democracy, and cited the example of the Reconstruction era as a moment, a brief moment, which that expansion made a difference despite opposition and conflict. And had some really good discussion with the high school students about the parallels between then and now in terms of ways in which and looking at ways to expand democracy and citizen participation. And so that's my report.
Great, thank you. Does anyone have questions for Ken Clark? Amanda Champion?
Yeah, just interested in the documentary. Is that something I think you said you got a grant for, or?
Yes, we were encouraged last year to apply for Cornell Just Futures grant. And one of the categories that the grant funded were related to immigration, migration, which is dispossession, and racism. And so I myself and Richard Rivera, who I've been working with some students to do research in this area, we applied for this grant and won a $25,000 grant, which would enable us to do programming on this area, to create a documentary, to capture these themes, and to really provide an opportunity to look at the real life impact on people who are living the experience. And so that was the grant that we were awarded, I should say.
Great, thanks.
A year ago.
Any other questions or comments? Okay, thank you, Ken. We appreciate it.
You're welcome.
Okay, Kate is back. Kate, would you like to finish off your report?
Yes, can you guys hear me?
Yeah.
Okay, good. So I apologize for that.
That's
I'm having technical difficulties today. I was just mentioning that yesterday the Tompkins County Community Services Board Mental Health Subcommittee hosted a conversation virtually with representation from all the different school districts in the county, talking about the mental health needs of our youth. It was a really good conversation. Most of what they were saying was mirroring things that we've heard from Suicide Prevention, Collaborative Solutions Network, even the Youth Planning Task Force, and our own Youth Services Board. Basically, the gist of that was that they need more mental health providers in the school. But the thing of note that I thought was of interest, that they said that they needed more pro-social activities around maybe recreation or expansion of positive youth development programs to sort of help the growing number of youth who maybe don't have an IEP or have a diagnosis, but need to have interactions with other youth and social experiences to help reduce that stress. So I think that was really interesting, and will be further conversations that I'm having with you as we move toward the budget for recommendations around mental health and youth development in general. In that vein, I was talking with Bridget yesterday, who made a request. We're going to reach out to Brandy Remington from TST BOCES. Hopefully they will come and do a presentation for this committee in May on the Clyde data that is out, so that you guys can have that as well. And then I did want to highlight, there was an invitation for you guys. We're going to be at that IC for a DEI training. County department heads and deputies will be. But the town gown from Cornell is happening on April 9th from 9 a.m. to 1:30, and the focus was going to be childcare. So I thought I would highlight that. So if that was of interest to anyone to attend, I thought that would be a good opportunity to hear more about the initiatives that they're doing. And lastly, I just wanted to provide an update. We have recently interviewed for the 2 positions that were available in our department, the service specialist. I think we're really close to making an offer and hopefully getting someone in. And if you'll remember, one of the big parts of that person was to really take up the initiative and equity need in the community. We've been hearing from summer providers that there are a lot of issues with some of those behavior things, and they don't know how to train staff or access resources to help address that. And this person will be the lead on that for the county. So we're really excited to get that up and going. We did also do an interview for the project assistant, but unfortunately I don't think we found someone, but we'll continue to work on the deliverables to make sure that we have something for you guys before the 2025 budget season really gets underway. And that is my reports for you.
Great, thank you. Any questions or comments for Kate? Randy?
Yeah, I'd just like to add on that presentation on childcare. One of the other members of the Youth Services Committee asked about how they're getting employment for people in daycare, and they get a lot of employees from the Youth Employment Services Program, and a lot of their employees are younger. And they pay a living wage there, but they're still struggling to get people, and they could actually have a few more slots, but they are short on people. And so they are working with some workforce development through the Ithaca Area Economic Development, I think, but they're trying to figure out how to find people. But one of the things that she asked, somebody asked about the condition of the kids when they come there for employment. And I think Heather was her name, went on for quite some time about the challenges of youth and how socialized they are, and how they don't understand really how to work, and that's what Youth Employment Services is, but she says it's gotten dramatically worse, and they need help. So I just wanted to share that.
Thank you. Okay, thank you, Kate. We appreciate it.
Absolutely.
And next, we're going to move on. We do have a few advisory board appointments.
Don't forget John.
Oh, I know. We're going to do all the voting stuff first. I got this. It's in my first rodeo.
When Dan was here, I always had to remind him.
Okay. Okay, we have advisory board appointments, Human Rights Commission, Cassandra Ponton, member, term expires December 31st, 2025. Griana Kurobacher, member, term expires December 31st, 2025. And if I could have a mover for these advisory board appointments, moved by Travis, seconded by Amanda. Any questions or comments? We can also, if there's privacy needed, we could go into executive session to discuss. Okay, let's do roll call. Randy Brown?
Yes.
Travis Brooks?
Yes.
Amanda Champion?
Yes.
And Susan Currie?
Yes.
And I'm a yes as well. Next, we have minutes, February 21st, 2024 minutes. Can I have a mover, please? Moved by Randy, seconded by Veronica. Or Veronica's not even here. Amanda? Any questions or comments? Okay. Roll call vote. Susan Currie?
Yes.
Randy Brown?
Yes.
Travis Brooks?
Yes.
Amanda Champion?
Yes.
And I'm a yes as well. Okay, now for the main event here. John, would you like to join us up here?
Sure. Sit on the other side.
Okay. And John Mazzello is here from the Human Services Coalition, and we wanted to invite him in to talk a little bit about the process and the work that Human Services Coalition does for the county. They are our vetting machine, shall we say, for much of the funding that goes out to our nonprofits. Without further ado, John is here with us. Thank you, John.
Great, thank you. And I think Lisa's going to kick us off here, and then I'll share my screen while she's talking.
Sure. I volunteered. So John and Cindy Wilcox came to county administration very early on in the year to try to get a jump on this year's process, and with a goal of being responsive to the requests that came from the legislature in the budget process last year about opening the process, making sure that the application process for agencies for funding in the annual process is open and available to just more widely open and available. And so in having those conversations, it uncovered that in doing that, there are potential implications in doing that, and wanting to understand the direction from the legislature to make sure that the Human Services Coalition is meeting the expectations for what you're looking for in this process. So we wanted to start this dialogue prior to the 2025 annual budget process to see where things stand and to hear your feedback.
Great, thank you, Lisa, and thanks everyone for being here. You may notice that Cindy is not here. She's in the emergency room with her son, so I'll cover her part and mine and see if you could tell where we were planning to split it up or not. All right, let's see if this works. There we go. All right. So today we'll just talk with you or I'll just talk with you for a little bit. Our goal is really for this conversation today to give you an update on the 2025 process, which is beginning imminently, just like your budget process. Ours begins earlier than I think everyone imagines, and really just to talk with you to be sure that, as Lisa mentioned, we're giving the legislature what it needs to make decisions in the fall around the budget, and also that we're giving our agencies that participate in the process, what they need as well. So we're really glad to be here. I'm glad to be here earlier this year. Last year, I think we met with you in May, and then the full legislature in June. So really excited to be here earlier to be able to have these conversations before we kick things off. Just a couple of items. Our slideshow is short. Just to give you a brief reminder about what HSC does, go over the process and how we've structured it, give you a heads up on what's next, and then really get into that conversation. So just a couple of slides to go through here. So just as a reminder, at Lisa and Norma's recommendation, just to remind you all that we do besides just this process, the Human Services Coalition has a mission to enhance the delivery of health and human services in the Tompkins County area, and we're really driven by our vision of a community that embraces the dignity and well-being of all people, supported by that vibrant nonprofit sector where our roots really are. We have 4 big program areas. We have our human services planning, where we work to build capacity in the not-for-profit community and really bring those resources to be able to meet the needs of the community. We have our Health Planning Council, which I know many of you have been part of in various ways. That's to increase health equity, to work with many partners to bring information and resources around how we support folks through all the different ways that health manifests itself in healthcare and health services. And we particularly provide some services around health insurance enrollment and using health insurance through our community health advocates. We have our Housing Initiatives Program, again, another one I know where many of you have lots of interest and involvement. It's really working to build a coordinated response to housing insecurity in Tompkins County. We're the lead agency for the continuum of care. We provide lots of education and planning and support of the organizations that are working in that field. And then finally, our 211 information referral helpline. I like to think of that as like the grease in the engine of the human services community, getting people referred to the right services and the programs that can support them, and helping people who aren't sure where to turn to be able to make those connections. So just a little overview of what we do overall. But we're here to talk mostly about our funding review process for this year, and we like to call it the Community Agencies Funding Review Process, or what have you. And there are kind of 4 big areas that I like to think of this process in covering. First of all, to provide a structured process for agencies that are seeking county support, particularly those agencies that are not being funded through a budget line item or for a program that's not being funded through a contract with another county department. This is really a little bit more open and flexible there, but a structured process so that you all are not responding to those throughout the year, and really to provide an opportunity to bring some of the expertise and resources of the Human Services Coalition and our partners to make recommendations to you. It's really important for us to consider each applicant individually and treat those applicants with the respect that they deserve. We've got lots of different kinds of organizations in Tompkins County, from mature, long-standing organizations to new ones that are just coming up, and the Human Services Coalition's mission is really to work with all of them. So we really try to think about the experience that the agencies have in applying and going through the process, and that's really important to me, particularly in thinking about how we do that. Sometimes I put my grant writer hat on when I'm sitting there as a facilitator of review process, and think about how would I feel if I were asked these questions, or if I were going through this process, and we try to make that work for folks. We like to, we leverage HSC's experience. We're connected in lots of ways with many of you. We're connected in lots of ways with many of the initiatives, and we've been doing this for a while. So we try to bring our expertise and role in that to support organizations that are going through the process, and also to make recommendations that we think are supportive of the county's goals and respectful of the taxpayer dollars that goes into this. And then finally, we have a number of different stakeholders through this process, but really, want us, as Lisa mentioned, support the needs of the legislature, county administration, and those agencies that are participating or considering participating. So that's just an area that we want to focus on all of those needs as we do our process. So I like to put the timeline up here because while we have kind of a main crux of time, really we're working with agencies or with the county throughout the year. And so just to kind of walk you through what we're looking at for 2025, even though it's in 2024, and I always think about Kevin McGuire used to always say, in the budget, you're living in the past, the present, and the future all at the same time, and that's true for us as well. So in the beginning of the year, up to now, we've been working with Lisa and with Norma to talk about the upcoming process. We are in the midst of doing check-ins with our agencies that have been funded for 2024. We want to make sure we talk with them before the process begins to see how things are going, so that it's a little bit more open and honest. Once you become an applicant again, it's just a different kind of relationship. So have those conversations, see how they're doing, get some feedback that we can bring to our review committee about how just the organizations are doing overall. And I'll talk about this more in a minute, but we're starting work on entering outcomes and information into the new OpenGov budget platform. So you'll be able to see some information about that. Coming up soon, we'll be opening the application process, so I'm really glad to be here with you beforehand. So applications will open for a month or so, and we'll be really moving into that role of supporting applicants, particularly potentially new applicants or prospective applicants. Once applications are in, there's a review process. We have, for the past several years, met with all applicants. That's something that we started over maybe about 5 years ago to give everyone a chance to talk with the committee and answer their questions, get their, just to have a conversation with everyone. And then finalize recommendations for the county. In the summer, we put those recommendations into OpenGov. We meet with Lisa and we talk about them. And then, of course, in the fall, we present to all of you and provide more information as needed. And then once the budget is passed, we work with county administration to help to prepare all the contracts for the agencies. So it really is a year-round process. In addition to all those tasks that have time points, we also work with agencies throughout the year. You know, sometimes we're assisting new directors who say, oh, this is new to me, how do I voucher the county to get paid? And we'll work with the county to address, questions or concerns. If there's a particular project that an organization's been working on, we'll see how that's going. So we really work throughout the year, both with the county and with the agencies. All right, so what's coming up now? This is just 2 slides on things to know. So as you saw, that timeline is really driven by the county's budget timeline too. I think for many organizations that are considering requesting funding, they're a little surprised that we're talking about 2025 in April of 2024. And so that process though is driven by what we need to do to get information into the county. So we'll be opening applications up in early April, and then they'll be due back in early to mid-May. We'd like to give organizations a month or so, a full month or so, to be able to put that together. And as Lisa mentioned, really, our model of how the process was announced was based on previous legislators and previous county administrators' direction. And so we really want to be able to be responsive to the direction of all of you now. So we are committing to working with the county administration to announce the process, to make it available online. We'll also be planning to share the application and reminders with all of you, so that if you've got folks who have reached out to you looking for ideas around county funding, you can direct them either to us or to the application. And it's really important for us to be able to support new applicants. It's something that I spend a lot of my time on in the spring. We've already met with, I think, or scheduled 4 or 5 new applicant meetings already this year, but really want to walk through prior to folks taking the time to apply. In some cases, we'll meet with organizations, and it'll turn out this is not something that they're interested in once they meet with us. Maybe there's other funding streams that are more timely for them. Maybe there are, maybe their capacity isn't for right now, but is something they want to keep in mind for the future. It's really important for us to be respectful of the time of applicants and their resources. So, if we can have a conversation, answer their questions, make sure that things make sense to them before they take the time to apply, that's really ideal for us. As I mentioned, sometimes we have folks who meet with us and they're looking for some money right now. And they got a project that's happening, they got some capital expenses or something, and we say, well, this will be for 2025. And then we can help them think about other things. We might make connections with them to other local private funders or other grant programs, help to try to open some doors for them in some other ways. But it's always worth clarifying for folks, because you don't want to go through the whole process to realize, oh, I'm not getting this money for another 6 months. That's not going to help me. So that's something that's really important for us. And then we provide assistance throughout the application time. again, a lot of my time spent working with applicants as they're preparing their materials, as they're working on what their proposal might be. And we do offer an early submission option that I would say probably about 40% of applicants have taken up since we've been offering it. So we'll check that over, make sure it makes sense for clarity, that they've answered all the questions, that there's not any areas where we think that the, there might be some confusion. And especially for, I think, to be honest, for newer executive directors, new organizations going through the process, this has been really helpful because it gives them a little bit of a feeling at an earlier point for how things are going and how they might be able to best articulate their request. So this is something that we have offered for maybe 3 or 4 years, just to make it a little bit easier for folks to see how things are going and feel comfortable that they've answered all their questions, or that they sometimes you'll think you've explained something really well, and a third party person will read it and say, I'm not really quite sure what you're getting at. And so it's just a nice way for them to have it. And not every funder does that, but that's something that we're pleased to do. It makes it easier on our end as well, to be honest. Another piece that is going to be different this year is how we're providing outcomes and evaluation information for the county. With the new budget software with OpenGov, we have an opportunity to put different kind of stories in for each of the agencies. And we met with Norma a couple of weeks ago to kind of strategize about how we would do that. We thought we might do this last year, but then with the way that the process rolled out, we didn't have the opportunity. And I think it was both for the agencies and for us and for you, I think it was missed. We previously had used the PIA forms to share as much as we could wedge in information into that particular form, but share with you all what the organizations do, what they're planning to do with the funds. Without the ability to do that last year, I think there's just, we had a missed opportunity for education around the organizations and what they do. So we're really looking forward to starting that earlier. In 2024, or for the 2024 process, we requested a number of goals from each applicant or each funded organization that we'll be able to put into the system. And we're still working exactly with Norma about how we're going to put that in. Some of the goals fit better into OpenGov's structure. Kind of guessed what it might look like last year, so now we see. So we might have to do some refining with folks, but we'll be starting to put in, after the end of this first quarter, starting to put in some of the measures and the numbers that the agencies funded in 2024 are doing. And then in the 2025 process, we'll be able to include information about the goals and activities that they're proposing. And our hope really is that should provide deeper information about the agencies and their programs and the progress that they're making for all of you. So that's a nice, I think it'll be a nice benefit of the new budget platform to be able to do that in a way that's more graphical, a little bit more user-friendly than trying to read. I know sometimes in doing the PIAs, we shoved about 3 paragraphs into that little description field. So hopefully it will be a little easier for you all to read as well. And then finally, my last slide here with any content really is just to give you a sense of, as we move into our conversation, give you a sense of the considerations that our review committee, which at this point is around 8 to 10 folks. We're still we're still securing some new members and getting everyone on board for this process for this year, but usually 8 to 10. What they look at in considering which recommendations to make and how they consider those proposals. So we look at the need and whether there's the need that they're proposing to meet is well documented and significant in Tompkins County. We look at the organization's capacity to carry out the program. Are they able to do what they say they're going to do? We look at the application itself. Have they answered the questions? Have they submitted it on time? Are they including accurate financial information, responding to the questions? What is the organization's fiscal background? Do they have the revenue that would allow them to carry out the program? Are the expenses reasonable? Are there any questions there? And we have in the past sometimes worked with agencies who are struggling to either report or to kind of identify ways to stay sustainable. That's been an area where we have worked with agencies in the past to help them out a little bit. We've worked with some around reporting and help them to identify maybe a way to recruit a new bookkeeper. We've worked with some around thinking about how they look at costs that they weren't recouping in different ways. So that these are areas too where not only do we look at them, but also can identify some opportunities for HSC resources or maybe some support to go to them. We look at how the program is overseen, how's their board, what are they looking at? Is there, if you're proposing to provide 10,000 services, but you have only a half-time employee, how do you propose to, do what you're saying you're going to do, and do you pay your staff at a living wage, or you're working towards that, which I know is a priority for the county as well. We look at access, a big area for us. We look at access and how the organization looks at the diversity, equity, inclusion, and justice elements of the work that they do. And then finally, we look at the strength of the proposed program and the impact that they're proposing and demonstrating through the application. So these are just some of the areas these are the areas that we look at in different ways through the process. And then my last slide is just really for us to have a little bit of a conversation. As Lisa mentioned, we want to really be responsive to you and ensure that organizations feel aware of, knowledgeable about the process, but we also want to think about what the implications are. For example, let's say if we have twice as many applicants this year, we think it would be useful just to get a sense of your thinking around some of that, to be sure that we can be the agent for you in the best possible way and bring the recommendations to you that are most helpful, most appropriate. And so just a couple of areas where we might want to talk about, but certainly anything, is one place is looking at organizations that haven't applied in the past versus organizations that have, and thinking about supporting growing programs, but sometimes they're a little bit more experimental or more in a pilot mode versus existing organizations that might be mature and have programs that we understand and have demonstrated some success. So thinking about your thoughts around the mix there. Thinking about, how we might look at one-time funding to bring some new folks into the process and kind of see how things go. So really just an opportunity for you to share any of your feedback with me, which I'll take back with us. And then we can take that and use that to craft the process this year and be sure to bring you in the fall the things that are most useful for you. So that's it.
This is a lot of information, and it might be, I hate to put things off, but it might make sense for us to think about some of the questions that you've posed for us and have another conversation, maybe even next month, John? Just for us to get an idea of how we want to prioritize, because I know that, in my opinion, I think that there has to be a balance of newcomers versus, people that have the track record in our community. But looking amongst the four of us at the table and then Susan, I think we all have different priorities probably. And, but we could probably have the same conversation with 40 people and be able to pinpoint the top 5 things. And it doesn't matter if you're in Newfield, coming from Randy's district or mine in Forest Home, mental health, substance abuse, safety, housing, those are probably, I would guess, maybe the top 4. Amanda?
Sure. Well, thank you for all of this. This is really good. And I think for me, I'm not sure. Sorry, just trying to put my thoughts together. I guess I'm not sure. It's not you're not the panel discussion, or the panel that chooses, who gets the funding. They're not choosing based on the topic, right? It's not oh, we want to do housing, so let's choose only the projects or the organizations that have housing. It's based on these things that you've said, and I think you know, for me, the idea would be which projects are going to have the most impact? Like which projects can help the most people? I mean, all the things you've listed here are, obviously you have to look at all of that, but, and then I guess in terms of like new applicants versus old, I guess that is less important to me too. Like, I would like everyone, all the organizations to have to know about this, to have the opportunity to apply and, you know, not come in late in the game and say, oh, I never heard about this and why didn't I get to apply, you know? And I think that's happened, and that's not even necessarily your fault. Like, it's, you know, it's hard to get information out there to people. But so I guess, again, like, it wouldn't necessarily be about prioritizing new organizations, but basing it on these things that you've listed, but also like how many people are being helped. So those are my initial thoughts. But I also do think, like, you know, there's 5 legislators here, and I'm sure all the other legislators are going to have an opinion too. So I guess I'm not sure how we get, I mean, we could have another conversation next month and say, you know, folks, you need to come and join us, but I don't know.
Another thing, thank you for that. Another thing that I've kind of got in the back of my head here is, you know, just thinking about the timing of what we ask folks to do and not wanting to force them to rush, or even our reviewing committee has got to read, you know, 20 to 30 applications or whatever. One thing we could also do is, you know, we could think about this being like a transitional year. So push out, you know, be really careful and thoughtful about pushing out the ability to apply, but then also take some time at a little bit more of a leisurely pace to identify identify the direction. I think one thing that would be helpful for that would be that there would be, I guess, a level of stability for current organizations, to not necessarily say, like, we're completely changing the process this year and you got, you know, 2 days to deal with it, but rather kind of have a process that's along the lines of how we've done in the past, just, you know, much more careful about how we promote it, and then use this year to decide for next year, really, how do we do that? And if there needs to be education or, you know, a bunch of information that we can share about, you know, if you were to identify, for example, only certain kinds of organizations that you'd want to support, it would be something that we could really telegraph to organizations far in advance without there being a big surprise. So that's just an idea that might be worth considering.
Travis?
There's several things that I would look at.
Yeah.
One is for organizations that rely on this funding, that have been getting this funding, are their outcomes matching what they say, right? So if an organization puts in a request to do A, B, and C, and they receive the funding, that's great. And then what is the review process to make sure the monies were spent exactly how they said and they didn't change? And if they did want to change, what is the review process for that? How does that work, right? And then what are the outcomes and how are those outcomes measured? Because if a program is doing good work, you want to keep them getting those funds, right? Because they're having an impact on people in the community. But sometimes that's not how it works. And programs, agencies get funding. What they expected to do didn't exactly go how they wanted, and they keep applying for funding, and they keep getting it because it sounds great, but it's not actually doing what it was intended to do. So I think that existing programs, you know, sometimes you really have to look at what those outcomes are and how they're making use of that money, and are they doing exactly what they said they would do. Another thing to me would be, you know, for programs that are getting money, is there a goal for them to become sustainable in another way? I do know that there's programs that get money from you all who need to keep continuing to get that money because they're doing really good things. So I would never, you know, want to say, okay, existing versus new. And then the question is, how do you bring in new folks? And then how do they go through that same process? And so over time, are they doing what they said they would do? What the priorities are, I mean, there's probably 5 or 6, and they're probably in different order to us and to others. When you have your review committee, I'm sure the people sit in that room, everybody kind of has the general priorities, and how they rank to them are different. I think it's healthy to have different priorities being addressed each year, so that, you know, each year it's not just housing, it's not just daycare, that we are taking care of different folks in the community. But every year having people having the ability to come into the space and be able to look for funding is important. There's not a lot of grant opportunities where you could say, okay, I have this great idea, and this is what it's going to cost, and you can go find money for that. Most of the time somebody says, this is what we want you to address, here's how we want you to address it, now ask for the money. And your organization isn't set up for that, or the people who put out the RFPs, they don't really understand how this work actually happens. So I think the way y'all do it is great, because it gives people an opportunity to recognize an issue, come with a plan to address it, put a monetary amount to it, and then find that funding to do exactly what they think is best. And most often it works out well. So that's a great process. So I think just trying to figure out each year, maybe it's 2, 3, 4, I don't know what the magic number is, but what's the goal every year to bring people in? Maybe people, when they come in, they know that, you know, they have up to 5 years, and during this process they have to start looking for other funding, so that this can be sustainable, so that you can keep allowing new agencies to come in. But at least people know, all right, if I get in here, we got about 4 or 5 years to figure this out, 3 years, whatever that number is, and then we have to start looking or figuring out how to make this sustainable. And I think that's fair. So I like the idea that it's going to be open, and that people will have the opportunity.
Yeah, thank you. Yeah, I think for, you know, particularly for the measures, I really like this new way of you know, and Norma reached out to us early last year with the Open Gov and started looping us in. I really like the idea of being able to provide more of that to all of you. I think that, you know, with the funding being a little open in terms of how, you know, rather than us saying we need XYZ built and you are going to build it to our specifications, it does mean there is some change over time. And we do see, you know, organizations might say, well, we tried that last year and it worked great, or it didn't work, but our program is still good, but this new idea just didn't work out. And so having some give for that, but also having some, you know, understanding. So one of the things we've been working on over the past couple of years has been, you know, a mix of both this year's goals and let's talk about last year's goals. So for returning organizations, we do have a slightly modified application form. We'll go back and ask them some questions that are related to what they said they would do in the past. And of course, we're talking with them throughout the year too, but in the formal setting. So, you know, if you said, you know, a common one is to say we want to increase outreach into rural areas, or we want to, you know, there's a group that we've identified as not being served, and we want to try to figure out how to serve them. And so we're going to start a new initiative to do these 3 things. And so that's a good opportunity for us to say, okay, how did that go? What did you learn from that? You know, over the past couple of years, there were a lot of great plans that didn't work out for various reasons out of the control of some of the agencies sometimes. But it gives us an opportunity to say, like, if it didn't work, why? And if it did work, why? And that is so much more rich information, and I'd like to be able to share some of that, obviously not all of it with you, but some of that at the high level, so you can see what's working, how an organization might change, how they change in response to changing needs, and also to say, you know, celebrate the successes. So I appreciate what you said. Appreciate it.
Andy?
Yeah, thanks, John. Each time we speak or you present something, I learn more about the Human Service Coalition and the value it does. But I do have a few questions. Does all the funding for these nonprofits come through you? I mean, it's all the funding comes to you, and then you do contracts, help the administration do the contracts. The actual payment comes from the county?
Yes, the payment comes from the county city sales tax agreement, and in that agreement, there's a certain amount specified for Human Services Coalition to give to community agencies.
So we don't do any additional appropriations from any other lines, or we can, but we don't, maybe?
We can. Yes, there is core funding, and then there's, through the process, at times, over-target requests are granted.
Right.
Yep.
Okay.
Yeah, it's about I think in the past year, I've got the total numbers here, but I didn't do the percentages. It's often about 60% county tax levy and 40% through the sales tax through the city, not including any over-targets, has been the mix for the last couple of years.
Okay, thank you. I have a few other questions, but I'll save them. I think we might be surprised how much we agree. I've always believed that. But I have a question on, do you actually review the financial audits of each applicant, or look at their reserves and those kinds of things, or?
Yeah, that's the nice benefit of having a kind of a mix of a committee. So yes, so not every organization is audited, depending on the size. There may be a review, but we do ask each organization to provide. It's, again, tricky this early in the year. Some organizations won't have gotten their audits or reviews done for last year, so we are looking at the previous year, but we also, in addition to those statements, request current financial statements, same type that they would provide to their board. We have our committee review those, as well as our finance director, and we do often have questions about that, or areas. As you mentioned, a big topic of conversation with with the committee and conversations when we meet with the agencies is around a reserve. Some organizations are looking to build a reserve. Some have a reserve and are thinking about how to use it. Some, it's not always so obvious, because you might have programs that get other funding, maybe they have state funding, and their particular state funding, as you heard earlier today, may run 6 to 9 to 12 to 18 months in arrears. So what looks like it might be a healthy fund balance is actually their cash flow cushion. And so all of those things are kind of considered, organization by organization. But yeah, we ask them for their financial statements and those audit or review or compilation documents.
I'm really glad that you're using the OpenGov, and I hope that's working well for everybody. In monitoring the outcome, as these folks mentioned. I like the idea of new applicants, which may mean that, if you don't have extra funding, then if you approve those, you don't have funding for other people. I always encourage people to, in your professional organization, to ask for what you think you need. So, and I may not be in the same opinion on that one. So.
Susan Currie.
Yes, I want to go back to, just have a procedural question. You said that when people, organizations who have received money reapply, then you go back and review what they did and you check in with them. I'm wondering, do you review every application? If someone has received money, do you follow up with them each year to say what worked, what didn't work? How to go forward? Or is it only if they reapply?
Oh, right. Okay. Yeah, sure. So, so for organizations that have applied and they have chosen not to apply again, we still would work with them throughout that year that they're receiving funding, for sure. Yeah, so we check in with them and see how things are going. We also, sometimes you'll see organizations that have applied for one-time funding, and we might be working with the county administration more specifically around tracking some of those things. Sometimes they're things that came out of a legislative priority. Sometimes they might be like a 3-year project, and it's of value to the legislature. So yeah, we do continue to work with them. Obviously, the level of checking in after the fact would be more for someone who's coming back. But yeah, during that year that they're funded, we continue to work with them.
Great, thank you.
Are there any other questions or comments for John? Great. Well, thank you, John.
Thank
We
you.
appreciate your time and hope Cindy's son is all right.
Yeah, me too. All right, thank you all.
Great, thank you.
Thank you.
Okay, any other questions or business for HHS today?
I'd like to bring up something. I've talked about youth mental health a few times, and we talked about it end of last year. Travis spoke of it as well. And as Kate mentioned, the subcommittee, mental health subcommittee, just had a forum. I wasn't able to go, unfortunately, but I had been in contact with numerous people who attended. They're all professionals, and teachers, counselors, therapists, and they, my opinion is that it is what it is, and our kids need help. So I don't know how to do that. So I've got ideas, and all these people have lots of ideas. So I talked to Dan about a task force. I'm not sure that's the right thing to do. Maybe it's something, and he goes, well, what are you going to do with this, right? And I think we had that conversation as well, as I was somewhat unguided to where I was going with that. But I've, in my opinion, I think there's solutions. And I think that people have a lot of ideas on what the solutions could be. And a lot of it is based on engagement and social interaction and connecting people. But I don't think that there's a good method for how that happens. We have lots of people doing it in their silos, right? And just with the people that they have, there's a lot of volunteer organizations in the county throughout the county doing that, focused on engaging youth and focused on their health and mental health and activity-based things. But it's not cohesive. It's very kind of birdshot approach to things. And so my thought of this is that there's got to be a collective that really understands what we're trying to achieve. This group's trying to achieve this. This group's trying to achieve that. In many cases, those groups are very successful with a small group of people, all volunteers quite often. But I don't feel that they're supported. They're not acknowledged. They're not helped. They're not assisted. They're not funded. So I don't. I'm not going to let go of that, obviously. And people are constantly saying, and you can read it, and all the reports are saying it. Even New York State's reports are gloomy about our youth. Maybe one of the reasons we can't find people to take jobs is because this transition of our children over the last 10, 15, 20 years, I mean, they haven't been set up to succeed. So they're just put in these positions. They're no fault of their own, and they don't have opportunities. You know, what opportunities they do have aren't good. So I don't know if the subcommittee should be taking this on, or how that process could go. I'm open to ideas. I'm willing to go it alone, but I'm not going to let it go. So.
I hope you don't let it go. It's important. Is this something that, I don't know if Frank is still on. Oh, there he is. Frank, is this something that Randy might be able to work with you and Harmony on to figure out how to create programs or have the conversation with the people that can actually, you know, that are doing the work that can help our community?
Yeah, absolutely. We'd be happy to help.
Harmony's reached out to me. It's like herding worms.
I know.
Not like, right, it's not like cats, it's worms, right?
Yeah.
So, and they dig in. I mean, and it's, yeah, I don't know the solution, but I know people are clamoring for it. And it's mostly around giving kids opportunities to engage.
Yeah.
And we know very clearly transportation is a huge issue of that. People, in fact, there was a study Minnesota did, they found out that parents can get their kids someplace, it's getting them home. So if you can just get them home, you're going to add 20% of the kids. So the problem's not getting there, it's getting home.
It's true.
So I mean, there's little things we can focus on like that. I know that CC, we provided funding for one of their buses, which is, I think holds 12 or 14 kids, and they're full. I mean, they're enabling to do more things.
Yeah.
So I mean, I think that we need to target solutions. And based on the feedback of the community and professionals, and invest in them through Human Service Coalition or whatever entity that is. And there are many entities that are already in existence that you wouldn't have to form, and they already have facilities, so it may not be expensive, is my point.
Yeah. I think what's interesting about this, Randy, that you bring up, like transportation, mental health, like the schools, like it's so many components that are siloed, right? Like it's, yeah. And so it's an interesting concept. So, if you could meet with Frank and, maybe even Frank and Kate, because, I think there has to be a marriage of sorts. I mean, it's just like, us talking about homelessness. You can't talk about homelessness without talking about mental health and substance abuse and, everything else that surrounds that, because it's not just one issue. So, Travis?
It would be great to bring a bunch of providers, folks that do the work, community folks that are interested in it, people like us together, and have like an afternoon where we look at what exists, what doesn't exist, what the needs are, break those things down. And then from there, figure out who would like to move forward and being part of some sort of group that would help look at addressing these issues, especially the things that don't exist, addressing the barriers. So for transportation, for example, a lot of school districts will get kids to where they gotta go after school, but then the issue of getting them from there to home, right? And so if we have a group of people that are invested in this and, you end up with 100 people in the space and 20 say, hey, I want to move forward and try to break down this particular barrier. There's a group that says, I want to address this barrier. You can work on the different components at one time. Yeah. And it's not one person, not one agency is saddled with trying to figure this out. Mm-hmm. You have different people coming together, and sometimes you can make some amazing things happen if you get enough people in the room to look at something and try to figure out how to remove barriers. Not so much create something, but just remove some barriers and get things moving a little bit.
Maybe it's like a summit with some breakout groups, right?
Yeah. I like that.
Yeah.
That works for me.
Yeah. Is Kate still on? Oh. So Kate and Frank, could we maybe have a conversation about putting together a little county summit?
Yeah,
and Lisa?
Absolutely. I think the work of the project assistant and the community cafes that we're going to do and the conversations that we had last year feed really nicely into this. And so we would love the opportunity to work with Frank and other folks, because it's Travis is right. There are so many different components, right? It's too big for just one person. So I think a community approach would be great.
Okay, more to come on that.
Great, I'll meet with those guys.
Okay.
Thank you.
Great. Thank you. Thank you all. Any other questions and comments? Okay, thank you all. Take care.
Great, thank you very much.
Thank you.